Now, let's address the elephant in the room, choking and gagging. Gagging might happen when babies try textured food and gagging is totally okay. Gagging is different from choking and it is a natural reflex. Choking is not common, but it is also not impossible to happen. So, what are some choking hazards? Think cherry tomatoes, whole almonds, cashews, raw apples, and grapes. See these? They are round, firm, whole foods. They are tricky. Instead of giving whole cherry tomato, go for a big tomato wedge or cut the cherry tomato in half. Offering soft foods as soft as Kaju Katli lowers the chances of choking. However, during meals, stay at a hand's distance and always keep an eye out. Kids are more likely to choke on non-food items like a small cap, a tiny ball, or a small Lego piece. But how do you differentiate between choking and gagging? What is choking and gagging? Choking may turn child's face and neck to a blue color. You may hear a high-pitched or no sound at all, and the child's throat starts to tighten. But during gagging, the child may open their mouth wide, may turn red, may cough hard, and look momentarily distressed. You will be able to hear their distress. Gagging can sometimes lead to vomiting as well, which is normal. In fact, gagging is normal. All babies gag. Some gag more, some gag less. If your child gags after multiple exposure to solid food and even after a month of practice you see no improvement in gagging, or your child throws up after every gag, it's best to consult with your health specialist for further assessment. Just because the baby gags on a certain texture, do not stop giving it. Babies need time to get used to of new textures. They have a strong reflex at the front of their tongue. So, when they try food on their own, they are learning about it, its taste and its feel. When you feed them, food goes to the back of their mouth too quickly. So they never move the food in their mouth to actually learn about it, except its taste. As babies grow, this gag reflex will calm down. Remember to help them out, let them explore different textures. Another question I'm often asked is, what if my baby takes a big bite and chokes on it? So, let's understand this. You see these two items? One's big and another one is small. But which one is safer? This tiny piece? So this is about the size of your baby's trachea. If this goes in whole, it can get stuck, making it difficult for your baby to breathe. But this big piece, if you give them something like this and they pop the whole thing in their mouth, the bigger piece has a lesser chance of getting lodged because of its size. The baby's tongue and reflexes will either help the piece to be chewed or it will be spat out. And just so you know, choking isn't exclusive to solids. Babies can choke on purees too, especially when they are not positioned right. Babies who are fed in an inclined position are more prone to choking compared to those sitting upright. Which is why always ensure that your baby is in comfortable upright position when eating. Their body language tells a lot about their comfort and safety.